Hello, my name is Haley Levelholtz, and I'm going to be talking about preventative medicine and holistic care nursing. What is it? According to the American College of preventative medicine is focusing on protecting, promoting, and maintaining health of the individuals and communities. Holistic nursing is looking at the whole person. It takes on a mind, body, spirit, emotion approach instead of merely focusing on the patient's current symptoms. Preventative medicine and holistic nursing go together because they both focus on taking care of the patient's overall health instead of focusing on one body system or symptom. The issue that I'm going to be talking about is how we tend to focus on the patient's current symptoms. What we need to do instead is look at the patient as a whole. For me, this is important because I work on a surgical services floor in the hospital on the inpatient unit. So it can be very easy for me to get caught up in the patient's chief complaint, maybe small bowel obstruction. I need to think about how everything as a whole fits into the patient. For example, if they're complaining about pain, what's contributing to their pain? Are they uncomfortable because they're in a new environment? Things like that. It's thinking a little bit deep. As I said, the goal is to think deeper about who patients are as people versus a task or something we have to deal with. Instead of viewing our patients as something to resolve, i.e. their pain, we should see them for who they are. A nursing diagnosis deals with the human response to potential health problems and life processes. The medical diagnosis deals with the disease or medical condition. So this is kind of a recap of what we've learned in school, just reiterating the important thing is to think of the patients and their responses to what's going on to them, not just what their physiological and responses to having a disease or condition. Hot topics right now are nutrition, exercise, aromatherapy, and other complementary medicine, and spirituality. Nutrition. The major cause of death, illness, disability include coronary artery disease, stroke, hypertension, atherosclerosis, obesity, diabetes, osteoporosis, dental caries, gallbladder disease, and dementia are all connected to diet and nutrition. I think we all know that patients with congestive heart failure and diabetes need to focus on nutrition and their diet. But do you often think about patients with osteoporosis or maybe dementia on how nutrition can relate to them? Nutrition plays a role in how patients feel. If a patient eats a diet full of fiber, they may feel less constipated and overall more comfortable. Protein aids in the healing process and may help the patients recover faster. A diabetic patient who is low in blood sugar may feel much better after drinking a glass of milk. Tip: assess your patient's nutrition status and ask what they typically eat at home. Do they like food at the hospital? Do recommendations need to be made to change their diet to promote health? Like I said, my background is working in an inpatient unit, but you can apply this to the clinic or counseling or a lot of different things. Nutrition plays a huge role in patients' health. It's good to address them. Have you noticed a difference in how you feel when you focus on nutrition? Do you feel better when you are eating healthier, like eating your fruits and vegetables? Do you have more energy? How do you think your patients would feel if their nutrition was better? What are we doing for the health of the nutrition of our patients? Exercise. According to the American Heart Association, they suggest at least 150 minutes per week of moderate exercise or 75 minutes a week of vigorous exercise. That can be 30 minutes a day, 5 days a week, or 2 to 3 segments of 10 to 15 minutes per day. I know in the hospital, in the inpatient units, and it's important to get our patients up in the hallway, get them out of their room and walking. Are we doing this? Are we making sure that our patients are getting the adequate amount of exercise they need in a day? According to Harvard Medical School, regular exercise can make changes to the brain to improve memory and thinking skills. It has been suggested that there is an increase in brain regions with regular exercise. Exercise can relate to cognitive impairment by reducing stress and anxiety. How can this relate to patients that have dementia? That posing now. Exercise can increase intestinal motility. Gastrointestinal motility is especially important for patients who have a history of constipation, small bowel obstruction, and have had surgery because it can encourage bowel movements. It also is really important for patients that are taking narcotics, that they're exercising enough to get their bowels to move. Are you ambulating your patient early and frequently? How much do you think this could help? How does this relate to the overall goal of holistic nursing and preventative nursing? I mean, think about it. If we're preventing our patients from getting small bowel obstructions, that's a huge part in the preventative medicine goal. Complementary versus alternative therapy. Complementary practice is used together with conventional medicine, whereas alternative practice is used to replace conventional medicine. So what this means is we don't have to replace what we're doing by the doctor, like, the pharmacological interventions and things that we can do this in addition to. This might be another step that we can take to help them feel better. Right, examples of these therapies is aromatherapy. We've started using them in the hospital, such as lavender and peppermint. Lavender is used for relaxation, which is great for patients that come in with dementia, and peppermint can be a great use for relieving some nausea. Reiki is a healing technique based on channeling energy into the patient by means of touch, massage, rubbing, and kneading of muscles and joints. We do back massages every night for our patients, and that can be a great way to reduce stress and pain. Acupuncture. There are several ways to do acupuncture, such as hand acupuncture, electroacupuncture, transcutaneous electroacupuncture, and regular acupuncture. An example of how acupuncture can work for patients is that it can treat constipation. There's a study done that I read that acupuncture can help with constipation by 52%. I don't think we think about how much evidence-based practice is behind these complementary alternative therapies, but it's becoming more and more popular and there's more studies on it. I would suggest looking into it and seeing if that would be a good recommendation for your patient. Spirituality. Spirituality is an influential part of the holistic care. It is the spirit portion of the mind-body-spirit approach to holistic nursing. An article that I read stated that spirituality gives patients better outcomes. Patients adapt to illness better and recover faster. Spirituality gives the patient a sense of wholeness and hope. It gives the patient meaning and value to lives. It's also thought to reduce stress. I think this is one of the biggest things that's missed in holistic nursing. When we think about the patient's physical needs, emotional needs, and psychological needs, are we thinking about their spiritual needs? It is well known that nurses are very busy and sometimes we don't have as much time as we'd like to sit down and listen to our patients. But a great way to get spiritual needs addressed by the patient is referring them to chaplain services. Chaplains are not only there to preach, but to listen to the patient and their families. Chaplains are a great way to give the patient support. They can just have a calming effect when they go into the patient's room to be another listening ear and let them know that they're heard. Conclusions. There are a lot of things we can do to encourage our patients to practice, promote, and prevent and maintain health. I hope this PowerPoint makes you think deeper on what you can do for your patients and maybe a step farther on what you can do for your own self-care and health. I hope you learned something from my PowerPoint. presentation. I know it can be stuff that we know we should do, but it's always a good reminder to be reminded that our patients' overall health is important, not just their chief complaint or the main illness that they're focused on. Thank you for watching and reading my presentation, and I look forward to hearing what everyone's takeaways is. Thank you. Bye.